Hello, myself Neerja Aggarwal. I am the CEO and co-founder of Emoneeds. Mental health issues are emerging like a silent pandemic. NIMS has conducted a survey over 12 states in India, and they have found out that in adolescent population there is a mental morbidity is around 7.3%, and among adult population it is around 10.6%, with a treatment gap of 70 to 90%. A depression, which is a well known condition, in depression itself there is a treatment gap of 85%. Over a population of 1.3 billion, which means our country has around 13 crore population which is struggling from mental health issues and this much of treatment gap. We have only 10,000 psychiatrists, 1,000 clinical psychologists, 2,000 psychiatric nurses, and 1,000 mental health social workers to cater to this population. And most of these professionals are residing in tier 1 town, which means negligible availability in tier 2 and tier 3 towns. Not only there is a distinct gap in rural and urban population, but also there is a stark gender gap in accessing the mental health services. Stigma associated with the mental health services make it very challenging to seek treatment, to go to the mental health facilities. And the situation is further aggravated by affordability and accessibility issues. Chronic illness like schizophrenia and bipolar affect the person's life to the extent that their day-to-day functioning is hampered, and excessive burdens come on the family who suffer the most, because it takes time to go back to the baseline and families are often ill-equipped to handle these conditions. Years living with disability is higher than any other health conditions, yet the global investment in proportion to the condition is not there. Actual recovery in terms of improved life quality, better relationship, and competent employment seldom happens due to poor medical compliance, poor understanding of the illness, unrealistic expectations of the family, frequent anxiety in dealing with life stresses, and proper hand holding leads to frequent relapses. So, Emoneeds is reaching to this unreached through digital products. We are translating empathy into digital products by utilizing technology using smartphone and smart devices. Emoneeds have been conceptualized to provide mental health care at the comfort of your home. At Emoneeds, our goal is simple: to prevent relapse to those who are dealing with serious mental illness and to handhold the less serious one to prevent from becoming serious. We leverage technology in the terms of that we have a quick decision support system, AI-based quick decision support system to minimize specialist times, and we ensure continuity of care through electronic database so that the patient can access their records, and in case they want to transfer their health in case they want to change their health provider, they can transfer the records from one health provider to another. It reduces the duplicacy of services. And once the psychodiagnostic is done, then proper hand holding is done through sessions, through cognitive rehabilitation training and social skill training if required. This online CRT and SST is our unique feature. You can only get them on IPD centers, but here at Emoneeds we provide online CRT and SSTs, and we touch base with our patients through daily monitoring call. This is how we fill the gap. Counselors touch base with the client through online monitoring calls. They feel supported and motivated to deal with life stressors, and it also increases their medical compliance and helps us in catching the early warning signs so that timely intervention can be provided. And it also relieves families' burden as the patient is more relaxed and family do not have to engage in providing reassurances again and again. We've conducted a research to see the effects of Emoneeds digital rehabilitation on the quality of life, functionality, and symptom severity in individuals suffering from schizophrenia. And we have found out that their quality of life, their functionality has improved, and their symptoms have gone down. And this has been declared the best paper in NIMHANS. Going forward, we are in the process of adding smart devices for monitoring and adding virtual reality tools to guide and shape behaviors in real-time scenarios. It will help us in reducing time and prompting recovery.